Hello, today we're going to speak about what thyroid test you should obtain if you have a thyroid problem. Greetings from Health Angel Solutions once again, your one-stop resource for thyroid disorders. Thus, the majority of females with thyroid disorders only undergo one type of thyroid testing, known as TSH testing. However, TSH testing alone frequently is insufficient to perform a full evaluation of the thyroid gland. Various tests are available to assess the thyroid gland, but sadly, conventional medicine only performs TSH testing. Nowadays, when we perform a single test, we frequently misdiagnose or mistreat thyroid disorders. We are not doing the complete testing, which is why a number of female patients with thyroid disorders continue to experience various symptoms even though their thyroid numbers, which are simply a TSH, look normal. Today, we will discuss what a complete thyroid test looks like and why it is important to perform one. Therefore, I believe that in order to do that, we must first comprehend how your body produces thyroid hormone. I know this will be a little confusing, but please do your best to follow along. The first place in your body where your thyroid hormone is produced is in your brain. There is a region called the hypothalamus in your brain, and it secretes a hormone called thyrotropic releasing hormone, TRH. This hormone then travels to your pituitary gland, which is your master pituitary gland. Now this hormone tells your pituitary to produce a different hormone called TSH, or thyroid stimulating hormone, which is the hormone that is most frequently tested in people with thyroid disorders. The pituitary gland then produces this TSH hormone, which is then transferred to your thyroid gland, which is located in your neck, and this into the more active thyroid hormone, or T3. As you can see, there are many different thyroid hormones, but we only check the thyroid hormone, or TSH, which means that you may now understand why the thyroid gland may be malfunctioning. For this reason, it's crucial and simple to check all these different thyroid hormones, which provides us with a comprehensive understanding of your thyroid gland's health and allows us to better manage it. All right, so this is the main cause of a long-term thyroid misdiagnosis. This explains why a number of women complain that despite knowing they have had thyroid symptoms for a long time, their doctor keeps checking their TSH levels, which is always normal, and tells them they don't have a thyroid problem until one day, several years later, when the TSH does return abnormal. However, what we find is that if we perform a complete thyroid profile, we can actually diagnose thyroid disorders much earlier and take appropriate action. The second issue is that once a thyroid problem is diagnosed, the only hormone that is checked again is TSH, and based on that usage, your medication levels are being adjusted or managed now. As you are aware, women with thyroid disorders frequently have symptoms that do not improve despite receiving treatment, and this is because the TSH alone is insufficient to help us manage the thyroid hormone correctly. For this reason, it is crucial to check all the different thyroid hormones so that we can better manage your medications. These are the various reasons why it is crucial to check all the different kinds of thyroid hormones in order to first perform an early diagnosis of the thyroid disorder. The second reason is that we can actually manage it better, and the third is that there is a thyroid disease condition called Hashimoto's, which is often missed if the TSH is all that is taken. Let us explain what Hashimoto's is. Here are the tests you need to check for both Hashimoto's and thyroid-related autoimmune conditions. Hashimoto's is an autoimmune condition that causes your thyroid gland to destroy itself. It is currently the leading cause of hypothyroidism, or low thyroid, in the world. If you aren't diagnosing the condition or aren't doing blood work to check for it, we are missing the opportunity to diagnose it. First, there is a test known as TSH, or thyroid stimulating hormone. This is a hormone secreted by the pituitary gland that aids the thyroid gland in producing thyroid hormone. If your TSH is high, you have a low thyroid, and if it is low, you have a high thyroid. Although it's a little confusing, the general idea is that your TSH level is the opposite of how your thyroid is functioning. TSH is a simple test to perform, and I believe that everyone should have it. Let's talk about the other thyroid hormone now. total and free thyroid hormone, T4, can both be measured in your blood. The T4 hormone is the inactive form of thyroid hormone that is produced by the thyroid gland. This means that the T4 hormone level is the next one that needs to be checked. What makes the difference now is that when your thyroid gland creates thyroid hormone, it essentially stores it or releases it into the bloodstream in a form that is more protective and coupled to specific proteins. In other words, those are essentially the vehicles that carry your thyroid hormone. Total T4 provides us with an accurate picture of your body's T4 levels, which are tied to this protein. Free T4 is the T4 that your body uses. Therefore, it's crucial to check both the total and a free T4 because although the total may be normal, the free T4 may be low, which could potentially be the cause of your poor health. This is the second test you receive, which measures the T4 hormone, both total and free T4. The T3 hormone is the third hormone level that needs to be checked. Now keep in mind that T4 is the dormant form of thyroid hormone. It travels to various bodily tissues and cells where it is transformed into 3, the active form. Currently, this 3 is likewise divided into 2, primarily in the free T3 form. Therefore, it is crucial to check the free T3 form of the thyroid hormone, because that is the actual hormone that is working. If you don't check it again, we will be unable to determine exactly what your thyroid gland is doing. The T3 is the third hormone that needs to be checked again. TSH, T3, and T4 levels can now be readily measured in any lab. Therefore, everyone should get those measured. The fourth hormone, or reverse T3, is the next one to be measured. It can be challenging to measure this hormone because not all lab tests detect it, and your regular doctor may not be familiar with it. What is the reverse T3? Well, keep in mind that T3 is a hormone that, when used for your body's benefit, is known to perform all these things. The reverse T3 is the opposite of your regular 3. Thus, if the T3 hormone acts as your body's accelerator, that is, the gas pedal, then the opposite T3 hormone acts as your body's brake, preventing it from working. That's a bad hormone, all right, you can say that. Reverse 3 is also very important to know about because in some people, it can be very high. For this reason, even if your T3 hormone level is fine, it's possible that your reverse T3 hormone levels are too high, which is preventing your T3 hormone from working properly. These are the 4 hormone levels that you are aware are necessary to check your thyroid gland's proper functioning. Next, you need to have blood tests to check for Hashimoto's disease, which is an autoimmune condition. As previously mentioned, your regular doctor may not be aware of it, so working with a thyroid specialist may be a good option. Reverse T3 hormone levels can be obtained through this method. Because Hashimoto's is an autoimmune condition, the antibodies formed with the disease cause the thyroid gland to be destroyed over time. This is why hypothyroidism, or low thyroid, occurs. If you do the proper testing and check your Hashimoto's at an extremely early stage, we can take steps to lower your antibodies and protect your thyroid gland. If you're not doing proper blood work, we are actually missing the diagnosis of Hashimoto's. Therefore, it is crucial to check these antibodies or determine whether you actually have Hashimoto's disease. I have spoken to a number of female patients who have had thyroid disorders for more than 20 years, and when they were tested to check for the disease, the results showed that their antibodies were extremely high. This allowed us to diagnose them with Hashimoto's disease, even though they had been unaware of it for that long. Therefore, there are 2 tests to check for Hashimoto's disease. One is known as a thyroid globulin antibody test, and these are the antibodies, which are created in opposition to the thyroglobulin protein found in the thyroid gland. These antibodies eventually cause the thyroid gland to be destroyed, which results in hypothyroidism or low thyroid function. It has been observed that thyroid globulin antibodies are elevated in autoimmune thyroid conditions like Hashimoto's, so it is crucial to have them examined. The second set of antibodies you should look for is known as TPO antibodies, or thyroid peroxidase antibodies. These are antibodies made against the tissue of your thyroid gland And research has shown that these antibodies are elevated in 95% of patients with Hashimoto's disease. This is what we look like as a complete thyroid profile, okay? Not just one thyroid hormone, TSH, but we need to get TSH, T4, T3, reverse T3. All these hormones to check how your thyroid is functioning, and then we also need to check if you do have Hashimoto's. You should talk to your regular doctor and make sure you do get checked for Hashimoto's because it's very important. These are the two antibodies, the thyroid globulin and TPO antibodies, which you need to get checked again by regular labs. By examining the TPO and thyroglobulin antibodies, two types of antibodies, hence, this concludes the thyroid exam. As we conclude our discussion on which thyroid test you should get, it's essential to remember that understanding your thyroid health is crucial for overall well-being. Whether it's the TSH, T3, T4, or antibody tests, each plays a vital role in diagnosing and managing thyroid conditions. Always consult with your healthcare provider to determine the most appropriate tests for your specific needs. If you found this video helpful, please give it a thumbs up. Share it with friends and family who might benefit, and don't forget to subscribe to our channel for more health insights and tips. Your assistance enables us to keep producing insightful material. Thank you for watching, and stay healthy.